Welcome to the Deep Dive.
Great to be here.
Today, we're diving into something where, well, precision is just absolutely critical, surgical anatomy. And we've got some source material describing a specific book.
Okay.
It's called 100 Questions and Answers in Surgical Anatomy by a Dr. Atef Ahmed.
Right, Dr. Ahmed. So our mission really is to unpack why surgical anatomy is so crucial,
Yeah.
And look at how this particular resource, based on what the descriptions say, tries to help medical professionals get a handle on it.
And who it's for, right? Students, surgeons.
Exactly. What makes its approach stand out, according to these sources? Let's see how the material is painted as maybe a shortcut to getting up to speed on this really complex topic.
Well, surgical anatomy, it really is the foundation. You can't overstate it.
It's more than just diagrams, I take it.
Oh, absolutely. Much more. It's understanding things in 3D, the variations between
Wonderful.
people.
Ah, the variation.
Yeah, and how tissues react when you're actually, operating. Predicting problems before they happen in that high-pressure ore environment.
Precisely. And mastering it. It's famously tough. Just the sheer volume of information is huge.
And you need it instantly.
Instantly. Under pressure. No time to look things up mid-procedure, usually.
That instant recall. Yeah, that feels so important. Which brings us back to this book the sources highlight.
100 Questions and Answers in Surgical Anatomy.
By Dr. Atef Ahmed.
And the descriptions really stress his background. Renowned surgeon, years of experience.
That seems significant.
It really is. It means the information isn't just theoretical. It's coming from someone who's been there, done that, you know?
Applied it countless times.
Right. Knowledge basically forged in the operating room.
And the format itself is interesting, 100 questions and answers.
Yeah, that Q&A approach. The sources suggest it's very deliberate.
Aimed at specific people.
Definitely. Medical students studying for exams, residents who are building their skills.
Okay.
And even experienced surgeons who might need a quick check on something.
So that Q&A style helps with testing yourself. Yeah. And quick lookups.
Exactly. It lends itself perfectly to checking your understanding, helping things stick in your memory.
And like you said, quick reference.
Imagine needing to double-check, say, the path of a nerve just before an incision. A Q&A could be really handy for that fast confirmation.
Okay, so it's positioned as that link, that bridge between the textbook stuff and the actual practical demands of surgery.
That's exactly how the materials describe it, guiding users through the subtleties.
Not just the big picture anatomy.
No, the details that really count when you have instruments in your hands.
And they mentioned exam prep quite a bit.
Yeah, indispensable for exam prep, they say. Probably because those exams often focus on applied knowledge.
Not just memorizing names.
Right. And then for practicing surgeons, it's flagged as a quick reference because that need for fast, accurate info just never goes away.
So let's dig into how the sources say it delivers. One thing mentioned is expert insight.
Yeah, and that goes back to Dr. Ahmed.
His experience.
Exactly. The sources emphasize his practical knowledge is woven throughout. You're not just learning anatomy, you're learning it through the lens of years of clinical practice.
So he knows the tricky parts, the common variations.
Presumably, yes. Which bits are often variable, where the biggest risks lie, the nuances that help you avoid complications, that kind of practical filter is gold.
The coverage is also called comprehensive, spanning head to toe.
Right. So the idea is it covers the breadth of anatomy that's relevant for surgery across the whole body.
Because surgeons need broad knowledge.
Yeah, you need readiness for different procedures. So a resource covering a wide scope, even if it's concise, is valuable. It suggests they've picked the most critical points for surgeons.
And a big emphasis on clinical relevance.
This is probably the core feature based on the description.
That's how?
Well, they say each answer explains the clinical applications, the surgical implications.
So not just where something is, but why it matters in an operation.
Precisely. Like knowing the path of the recurrent laryngeal nerve near the thyroid, that's anatomy.
Okay.
Understanding why you absolutely must find and protect that nerve during thyroid surgery to avoid voice problems, that's the clinical relevance. The sources say this book makes that connection over and over.
Which naturally feeds into exam preparation.
Absolutely. Surgical exams hammer applied anatomy. Clinical decisions based on anatomy.
So a Q&A resource focused on clinical points.
Would be perfect prep for those kinds of questions. Helps students start thinking like surgeons sooner.
And the last point mentioned is being A practical tool for surgeons.
Yeah, because even top surgeons do procedures they haven't done in a while, or they hit unexpected anatomy.
Right, variations again.
Exactly. So having a quick, trusted reference to just refresh specific details before a case, that can boost confidence, maybe even influence the outcome.
Makes sense.
The sources really highlight it, serving that need for crucial refreshers for successful surgery.
So pulling it together, the main goal described in these materials is really about boosting anatomical understanding specifically for surgery,
Yeah. And empowering people on that journey towards surgical excellence.
making this huge amount of complex information more, I guess, digestible and usable when it counts.
Accessible, applicable, and easy to recall under pressure. That Q&A format, plus the expert clinical focus, seems tailored to the specific challenges of learning and using anatomy in surgery.
And just practically, the sources say it's available on Amazon and Dr. Ahmed's own website shop.
So pretty easy for medical pros to get hold of it globally.
Okay, so let's wrap up this deep dive. What does exploring this material mean for you, the listener,
Well, you've gotten a glimpse into just how vital surgical anatomy is.
and the challenges in truly mastering it?
Right. And how a resource like this one, 100 questions and answers as it's described, tries to offer a focused, practical path.
It really highlights the value of knowledge coming straight from an experienced practitioner, doesn't it?
Definitely. Tailored for the pressures of surgical training and the OR.
It also kind of underscores that good learning tools in these demanding fields aren't just about dumping information.
No, it's about structuring it so you can grasp it quickly and actually apply it.
Right. So that leaves us with something to chew on.
Okay.
Given the incredibly high stakes in surgery life and death, split-second choices, how does having instant access to precise, clinically focused anatomical details, the kind this resource promises, how does that fundamentally change things for a surgeon?
Their preparation, maybe, their confidence.
Yeah, or their ability to handle those unexpected curveballs the human body can throw. Something to think about the next time you consider the incredible skill involved in surgery.